Jeremy Gonzalez. I'm going to be assessing the patient's PEG. I'm going to first observe the 7. I'm going to check the patient's doctor's orders. I'm going to basically wash my hands, come into the room, check the patient's ID band, introduce myself. I'm going to let him know what I'm going to be doing. I'm going to provide him with privacy, and I'm going to set up my station. As I'm doing the NG tube, what I need to make sure is that I have everything ready. I have my syringe and irrigation system. Okay. Okay. I'm going to have some normal saline for the irrigation process. Then what I'm going to do is I'm going to assess the patient's abdomen. I'm going to check for distension, okay? I'm also going to check to see if there's any irritation, or I'm also going to check the 4 quadrants for bowel sounds with my stethoscope, of course. Then what I'm going to do is I'm going to disconnect the feeding tube. I'm going to, through the whole procedure, I'm supposed to be donning gloves, first of all. That's number 1. And I'm going to disconnect the feeding pump. I'm going to clamp it, make sure that nothing comes back. I'm going to take my syringe here. I'm going to place it. And what I'm going to do is I'm going to aspirate. Basically, if I aspirate more than 100 cc's, what I want to do is I want to stop the tube feeding and report to the doctor. Okay, in this case, that's not what's happening. So what I'm going to do is I'm going to push it back in. Clamp. Now, I'm going to take 30 cc's of water. And I'm going to reconnect, and I'm going to slowly push the 30 cc's back in, okay? I'm going to clamp. Obviously, before when I aspirate it, I'm going to check for the contents of the fluid that came back. I'm going to check the color. I'm going to check to see if there's any blood or any, odor or anything of this sort. It wasn't. So what I'm going to do is I'm going to disconnect, and I'm going to connect it back to my feeding tube. Okay. I'm going to plug it back in. Okay, I'm going to make sure the patient is comfortable. I'm going to lower the bed. Give the patient a call bell. And I'm also basically, I'm going to make sure that the patient wasn't nauseous or anything during the whole time. Again, making sure that the patient's comfortable, lowering the bed to the lowest position, giving the patient a call bell. I'm going to wash and make sure that all my equipment is, washed and ready to be used, because it's good for 24 hours. I'm going to put it away and put it in a safe spot. I'm going to take off my gloves, wash my hands, and I'm done. Oh, wait. I should document before I'm done. Ins and outs. Thank you very much.